to our top story this morning. Limpopo Health MEC Phopi Ramathuba is defending herself. This after a video of her at a Bela-Bela hospital went viral on social media. She's seen telling an undocumented foreign patient that it's the influx of Zimbabweans in our country that is burdening the health system. Of course, we continue to get reaction. One of those is now joining us, Zimbabwe Exiles Forum's Tino Mambeu joining us on eNCA this morning. Tino, good morning to you. I appreciate your time. First question on this has to be, do you think Phopi Ramathuba is xenophobic?
Good morning, Gareth, and thank you for having me on your show. Now, there are two sides to this story where we look at, Dr. Ramathuba and what she said. The dimensions are that she spoke as a politician, and the other dimension is that she also spoke as a doctor who is probably in charge of the hospitals in Limpopo. So to give perspective to this, it will be unfair to say that Dr. Ramathuba was xenophobic in her statements. I think she has just highlighted the sentiments of many South African politicians and the general masses that the influx of Zimbabweans into South Africa has caused serious damages to the health situation in the country, and that the Zimbabwean situation has reached a serious calamity where now we think that South Africa is the government and the ZANU-PF is the ruling party in Zimbabwe. With the ANC, they must now come up to terms with reality and figure a way forward as we approach the watershed elections next year.
So where do we now begin to unpack a lot of the damage that has been caused by this as well? What are you hearing from Zimbabweans on this issue? Do they feel that they agree or disagree with Phopi Ramathuba? It's a case of they can't get the kind of healthcare they believe they can't back in Zimbabwe. It's why they're coming here. Is that the perception? Is that true, do you think?
Look, it is true that we are burdening the health system in South Africa. That is beyond any reasonable doubt. She provided factual information as to the number of, people, South Africans that are in the country that the Minister of Health would account for and provide a budget for. Now, there are so many Zimbabweans who find themselves in here, not because they want to be here, but because of the circumstances that are really beyond their control. Now, you find that Zimbabweans, face the risk of dying while giving birth in Zimbabwe. Against crossing a border and coming into South Africa where they'll get reasonable medical care. So they are caught between a rock and a hard place here, where they don't really know what to do. But it is not lost on Zimbabweans that the cause of these problems is not South Africans. The cause of this problem is our government that is led by Emmerson Mnangagwa. And I think in that video, you would hear that as far as she was blaming the patient, she also managed to tell us who is the elephant in the room. She said Mnangagwa is the one who is responsible for providing you with health care. Now you have crossed the border, and I have got to deal with MECA resources to make sure that you have health care. Now, as a politician, she is totally 100% right. It is known the world over that politicians will always seek to seize the moment. They are populist. And as far as their politics is concerned, we as Zimbabweans feel that she has done us justice in highlighting the issues that we continue to face on a day-to-day basis. Now, this will probably provide a platform for the ANC and ZANU-PF to say, how do we then proceed? We have an election that's coming in next year. Is this not an opportunity to at least have a free, fair, credible election so that these issues do not continue to happen? However, we don't want also to forget the issue that sentiments have the ability to influence the nurses, the junior ranks in the social, in the health services delivery. We have already seen that now there are reports that reach our offices that as of last week, there's a woman that went to the hospital. She was pregnant. She lost her baby, and in that moment, the nurses then said, you see, you have lost your baby because you are in a wrong country. So this settlement now, on the other side of things, is quite bad that we have got people being treated in that manner, where they only seek to be healthy, where they only seek to survive. That's the side that really pains us most. But the bottom line is ZANU-PF, the government of Zimbabwe, should do more to cater for the rights, for the rights and the lives of the people that it governs.
Just very briefly, Tino, before I say goodbye to you, What should the MEC have actually done? Obviously, caught on camera speaking to the patient, but we've even had the Deputy Health Minister saying that not necessarily it should have been taken up with the patient in this particular video. Would you like to see Phopi Ramathuba take this discussion forward? She's getting a lot of flack at the moment. Would you like to see her take this argument forward and try and escalate it and find a way to get budget so that everyone from all countries, anyone that comes into our country, can be treated for medical reasons? There's still a Hippocratic oath that doctors take. They can't choose who to treat just because there's no money and from where they are.
Now, speaking from the Zimbabwean perspective, I would appreciate that this issue is dealt with in the long term. Now, the long term of it is that Zimbabwe should have a free, functional society, that politicians are not arrested, like the issue of Job Sikala, that journalists are not persecuted, that people can live freely. Now, as far as coming to South Africa is concerned, we would wish that anybody that comes to South Africa should be treated, and that there should be a mechanism that allows the South African government to charge for the services that they would provide to the scores of people that come in here for treatment, and etc. You would know that Zimbabwean politicians and the rich come to South Africa and they spend money, serious money, in private hospitals. The VP Chiwenga was here when he was sick. The president himself was here when he was sick. He didn't go to a public hospital. He came into a private hospital, and those bills were paid. So what is stopping them? If they can, if they can pay private hospitals for their own health, why are they not paying the public hospitals for the health that is being provided to Zimbabweans? South Africa cannot keep on taking more and more of Zimbabwean problems. There's got to be an end to all this.
I appreciate your time in speaking to us. From Zimbabwean Exile Forum's coordinator, it's Tino Mambeu joining us this morning, reacting to that video of the Health MEC on social media, speaking to a patient here in South Africa. It looks like this discussion, Tumza, is not going to go away for a very, very long time.
No, it's not. And you know what? What I heard from Tino is exactly the tweet, more or less, I interpreted from Hopewell Chinwangwa. I'm sure you know him, the one of the at least famous and popular journalists coming from Zimbabwe, saying, the utterances of the MEC, well, he said the South African Minister of Health, but she's the MEC of Health in Limpopo, are a more reflection of the government, in Zimbabwe. I think if I'm just summarizing what the tweet said, he said ZANU-PF is an embarrassment to Zimbabweans, because now Zimbabweans in the Limpopo province or wherever in the country have to be now reminded through this video that their government is failing them, which Tino had mentioned. So those are the different views that I'm hearing, not only from South Africans, but Zimbabweans themselves, taking it back to their government to say, what is then our government going to do about this? How can the ANC and the ZANU-PF party work together? How can the Zimbabwean government and the South African government work together in the long term to find solutions to this?
I mean, there's bilateral relations. Why aren't we having this discussion at level? Maybe we are, maybe we should be. But we'll continue to stay on top of that story for you here on eNCA. Now, coming up